Good evening, everyone. I'm going to be talking on expectation from orthopedic PG students from the Indian subcontinent. And you would know that the PG degree in Indian subcontinent is of 3 years, the MS Orthopedics. And as you can see, the stepladder type of a picture which I have put on the first slide, which has more than 3 steps. It has actually 6 steps. And in the next 20 minutes, I would like to share with you certain objective things and certain subjective things which are connected towards the expectation from an orthopedic PG student as far as the training curriculums are concerned. My disclosure would be that I have been teaching in University of Delhi for the last 2 decades. And so a lot of my thoughts and content comes from the curriculum in this university. So when you think about expectations, there are quite a few stakeholders in it. The student obviously is the key, and the person or the main person who's going to get affected is the patient. The student is guided by the mentor, or you can say the teacher, where he's getting trained to give treatment to the patient without any harm caused during the teaching curriculum. And if you look at the same expectation at large, the society comes in. The student, the mentor, the patient, all three have a family. The family lives in a society. The society forms a state, and you have your own understandings, religions, acceptance and rejections of scenarios. So let's focus on what we would be aiming from a curriculum in post-graduation in orthopedics at the end of 3 years. So as I said, certain objective things, there would be certain essentials, and there would be certain things which are desirable. And these are the things which cover the art and science of becoming an orthopedic surgeon. So the most important thing I would consider it as a logbook, which is gradually gaining importance and is becoming a regular phenomenon in most other universities. And if it is not, it is high time that we get onto it. The second essential that a postgraduate does during the 3 years is a thesis, in which he does a research thesis in which he would understand basically how to do a research in orthopedic practice. And then towards the end, he would definitely have to clear an exam. This again is changing. A lot of universities are getting an internal assessment. So a gradual build-up according to the curriculum which is detailed in that university, they would be deciding their own internal assessments. So internal assessments are increasing value. And then there would be other things which are the journal club, the seminar, the conference presentation and publication. On the right side, I have put 2 bold essentials, which are books and journals, which obviously a student entering a postgraduate activity needs to go through. So it's a lucky period of life where the education is becoming more and more structured. You can debate structuring has its downsides also. But then our Delhi University comes out with a list of books which are recommended and which are changed time to time according to what the curriculum committee feels. And Google and internet is helping disseminate knowledge, but I think as a postgraduate student, you need to be studying and going through the recommended books and journals. There is a big change which is happening in medical education, and that is competence-based medical education. It is already taken a good structure as far as the undergraduate MBBS training is concerned, and it is also knocking on the doors of postgraduate training. And I see it coming, maybe it's already there actually. And as you can see, it actually delivering healthcare without causing harm to the patient. And it involves all things like skills, knowledge, attitude, experience. And it's just not only covering up certain topics. In the whole process of the expectation, something which is disappearing is Guru Shishya Parampara. And I would feel, and as would most of the teachers feel, that this is one of the very, very important part of our culture, which has an immense potential, especially in surgical training. The globe has realized this fact, and if you go through literature, you will find huge number of articles talking about mentorship. So the Guru Shishya Parampara has been designated the terminology of mentorship, and which now is very well accepted, especially in surgical field and of course in orthopedics. And it has its value because it is a passing on of art and science. Science could be understood going through literature, but art needs a guru to take you further. So I think the postgraduates who are listening to this talk should realize this, and it's not just a term, but it has a lot of value on what you reach maybe at the end of 5 years or 10 years from now. So with the increasing number of postgraduate students in each college and in each university, there is a change in the way probably the education can be imparted. And because of the sheer numbers, the expectations from the teachers have also got modified. That is where to handle the numbers is coming in the structured curriculum, which could sort of chase up and make sure that each person who goes through the postgraduate training has enough exposure and comes out as a good orthopedic surgeon. So let's look at a part of this talk which is more objective, which gives you some direction on where you should be moving. The goals and objectives of orthopedic surgery is developing the ability to evaluate, diagnose, stabilize, and treat the orthopedic patient. I keep telling on my rounds that postgraduate students are here for learning, and at the end of the day, healthcare delivery is the responsibility of the consultants and the senior residents. So in PG, you need to give a lot of emphasis on evaluation, diagnosis making, and taking early care, becoming a part of the team, stabilizing and delivering the orthopedic care. The postgraduate course is a self-study. It's an in-training course. And these two terms are very important. The student is expected to know the theory part of the orthopedic practice and patient care. The training has three distinct parts: the theory part, the professional behavior part, and the learning to do the procedures, which I was talking about, the art of orthopedic surgery, which comes under the umbrella of a guru passing on his experience and decreasing the number of problems you can do during your own training. So remember, it's a self-study course, and if you're being coaxed to understand and learn this, you're on the wrong bus. So you can see a fluoroscopy image on the right, which is showing a wire in the neck of the femur. And you would know the entry point, you would know the direction, you would know the angulation. But then it takes some skill and practice to get it right on there. So it's a very, very well knitted sort of a thing. And these are not exclusive of each other. In fact, they are inseparable at any given point of time. And the course intends to develop the entire professional personality of the student. You are actually maturing from a doctor to a specialist. The curriculum is constructed with an objective to develop all three domains of learning in the student, so that, as in this example, you could put the screws after reduction of the fracture in the most appropriate position. So most of the universities are now designing a program in which you have targets for year 1, 2, and 3. And then the year 1 again is divided into maybe 3-month or 4-month modules. And our university follows this. It has a 0 module, meaning the first year when the student joins in, there is an orientation time where we emphasize a lot on self-care. We put it in red because we've observed in the past few years that this becomes a very, very important thing at the beginning of this change from an undergraduate intern to a postgraduate training program. Communication skills is emphasized because here is when you start interacting with your colleagues, with the paramedic staff, with the patients in the interest of the patient care. Clinical workstation learning, cognitive plus non-invasive psychomotor skill acquiring, small group methods. Most of the universities and the colleges have unit-based teams, so the training goes on in that way. And there is always a requirement of a self-study. So in the 0 module, if at the end of the 0 module, you would be required to know plaster casting theory and hands-on on plaster techniques, primary splintage, types of splints, wound care and dressing techniques, hand wash techniques for OT, and documentation, including consent taking. It is thought of that it is a medical clerkship, but it is training you on documentation, and you realize with time how important it is. So the module 1 of first year, now these dates are according to the normal schedule of program starting in May. So the module 1 would be the August, September, October, where you would be exposed to research protocol, and you would be desired to design a protocol for your research thesis. Learning the methodology of preparing a presentation, targeted searches for a particular topic, and acquiring new intellectual skills, basic care of trauma patients in these first 3. And in our curriculum, we actually also keep telling them the resource material which could be useful to them. So at the end of this second module, you would be required to be supervised application of skeletal traction in lower limb, diagnostic aspirations under supervision, getting ready for assisting an operation, familiarity with the radiological monitoring in the OT, wound debridement under supervision. So you can see gradually there's a build-up happening in which you get into more and more complex care. So the next module between November and January will be focused on use of biomechanical principles, region-specific trauma, or maybe you can start from upper limb in some universities, some from lower limb, and understanding the principle of fracture fixation and the practical use. The AO manual is one book which comes in at this time. And at the end of this module, you would be expected to be assisting suturing of wounds, pressure dressings, drainage tube removals in the post-op patients, removal of simple unipolar planar external fixator, assisting removal of ring fixators, skin graft techniques, dressings, primary preparation for parts for major surgeries, familiarity with image intensifier, and assisting application of external fixator. So now you're gradually getting into the operating room as maybe the second assistant. And in the module 3 of the first year, which is February to April, you start presentation at scientific meetings, introduction to non-trauma conditions, maybe regional trauma, applying the basic knowledge to orthopedic diseases and formulating the aim of treatment. So you're gradually getting into the role of decision making now, and also starting presentation at various forums. So at the end of this module, you are assisting emergency trauma surgery. You are taught about types of surgical knots, familiarity with suture techniques for different tissues, documentation of a patient with neurological deficit on specified charts. So neurological assessment is starting now, assisting close reductions of simple dislocations. And that's what is expected in the first year of a residency, which is looks pretty comprehensive, and it is to be attained on your own as well as by the guidance of the unit where you're posted. And as you get into the second year, complex regional trauma office orthopedics, osteoarticular infection, all these things come in. And the first module, at the end of first module, you would be required to assisting local infiltration for common painful conditions like tennis elbow. So you're starting minor procedures, assisting split thin skin grafting, familiarity with special views of pelvic acetabular trauma, assisting arthrotomies for acute arthritis, septic arthritis, assisting a routine surgery. So you're gradually moving from maybe the second assistant to the first assistant. Getting familiar with common implants used in trauma surgery. And as you move on to the second module, which is August to October, you start getting exposed, or you start looking into other parts of orthopedics like oncology, principles of prosthetics, endoscopic surgery. So you would be expected to know this and learn or read or see, even if it is not happening in your institutes. And at the end of this module, you would be expected to have assisted core biopsy, getting familiar with basic AO instrumentation, and the various other details. So I would be happy to share the curriculum of University Delhi, which you can use as a module in your various colleges or institute and modify it according to your requirements. Module 6, Polytrauma, complex upper limb trauma, osteoarticular fractures, and here you start attending conferences. It's in the curriculum that you're supposed to be attending and presenting in conferences. And then the type of surgery become a bit more complex, tibial fractures, ligamentotaxis, fasciotomies, assisting traumas like hemiarthroplasty. And module 7, which is coming to the end of second year, you start your preparing your thesis, and thesis writing becomes an important part at this module, and also assisting miscellaneous elective surgeries. So the last year, which is the third year, again divided into modules. You would go regional orthopedic modules, like we start our focus with hip. Everything about hip, expertise in clinical assessment, investigations, concepts, procedures, documentation of hip cases, and examining and making a diagnosis. So you would, at the end of the first module, at least tick up everything connected to this module in your logbooks. In the second year, you move on to second important long case which comes in the exam, which is spine. So spine surgery, neurological and mechanical components of spine surgery, orthosis of spine. And by the end of this module, you should be assisting major spine surgeries, assisting cervical spine surgery if possible, supervised open and closed intermediate nearing, closed reduction impact and spinning of common fractures. So you're getting on hands-on as a first surgeon at times. And then coming towards the end of the third year, where you get into the miscellaneous, the congenital and other parts of orthopedics, and you would be required to know about such conditions and try to look at them in the clinics and understand how they need to be managed. Clubfoot, a very important thing. You get to start seeing them year 1 itself, but then by year 3, you would be probably the main person following up a case. So last module of year 3, you're going to be revising whatever you've done in your first 3 years, and you would be looking at certain things which were not touched, like rehabilitation, and you would be preparing for your exit exam, which invariably everywhere is a theory which has 4 theory papers and a practical exam. And the practical exam has a long case and 3 short cases and 4 table vivas. So you need to be aware of this so that you are preparing day 1 and you have a bird's eye view of what you're going to be doing. But if during your 3 years of residency, you are the mice and your mentors and teachers have been only chasing you to get you on track, I can tell you are on the wrong bus. It'll never, you might pass in the MS orthopedic exam, but you fail in the exam of life to deliver orthopedic care. So I think you should be the cat and chasing your teachers and seniors to impart their experience and knowledge to you. So the key to success, I feel, in orthopedic residency has a ABCDE to it. A is availability and appearance. B is behavior and body language. C is competence and knowledge. D is documentation. And E is ethics. And I can tell you, A and B has a very, very important role in becoming a good orthopedic resident, so that you can get your degree and then become a very, very good senior resident. So to end my talk, I would say it is not about capability only. All of you who join orthopedic training are good students because you finished your MBBS, you were the cream of the society, you cracked the NEET PG and got the best ranks to get this. So it's about the mindset once you get onto the horse and you decide where you want to take your future. So try to give value to this opportunity that you have got through the MS Orthopedic curriculum. And I think it has an objective part to it now. So if you chase up the objective part, fill up your logbooks, make sure the targets which are drawn now are ticked, you will be on the right road. Thank you very much for your kind attention.